Hi.
Hello, everybody. Welcome to Knock Knock Hi with the Glaucomfleckens. I am Dr. Glaucomflecken, also known as Will Flannery.
I am Lady Glaucomflecken, also known as Kristen Flannery.
I'm in the process of legally changing my name. Oh, I didn't tell you that.
Oh, okay. Well,
Just kidding. I wouldn't do
it's
that.
a pain in the butt. Yeah, I don't see you following through on all the paperwork for that.
Is there a lot of paperwork?
Oh, yeah.
Really?
It's a lot.
Ugh.
Yep.
You got to change like all your...
Because it changes everywhere.
You got to change your like driver's license.
You got to do that. You got to do all your credit
passport
cards,
and
bank
credit card.
accounts. I mean, literally anything with your name on it. Think of all the things that exist with your name on it.
Why would
Yeah,
anybody
it's a lot.
do that?
That's what I was saying, like 14
Terrible.
years ago.
So we have a live show coming up.
We sure do.
God, we love the live shows.
They're a lot of fun.
So much fun. And actually, it's good we're talking about this because it got me thinking about it just because of our guest today, Dr. Anthony Chin-Quee, who's a storyteller. And that's what we do during our live show.
We do. It's a story.
It's like an hour and a change long story that we tell using some characters
and tragicomic,
some monologues.
Multimedia memoir stage show.
That's right.
I think that covers everything. I didn't put in the characters. I got to figure out how to work them in.
There's characters in there too. I have a lot of dressing changes I have to do during this show.
It's true.
Which we've got it down by now because we did 3 very successful shows in Southern California in December, and now we're trickling out some more.
Yes, that is right.
So
we have one this weekend, and then don't worry, we will have more later in the year, and we will have details coming out for
March
those.
24th at 7 p.m. in Irvine at the Irvine Improv. All right, we did a show there in December, and it was so much fun. Sold out very quickly, so just make sure you try to get tickets if you haven't already. But if not, like we're taking this elsewhere too. So
we're going on the road later this year.
We're trying to nail down dates and venues, and it's we do have like a family and like jobs and stuff. So I've got to work around that, but we're trying to work around it. So we're talking maybe like 10, 12 cities, something like that.
We'll see.
Yeah, we'll see.
We'll have all the info on our website.
As soon as we know,
glaucomflecken.com/live.
As soon as we know, you're going to know. Yeah, glaucomflecken.com/live. Check that out. But March 24th, 7 p.m., Irvine Improv. Come on out. And our guest today is a guy that's done a lot. He went through otolaryngology training. So went to med school, residency, practiced for a few years, and then decided to leave medicine to find himself a little bit more
and pursue his creative side.
To pursue his creative side, which medicine tries to get rid of.
It sure does.
And I'm glad, and really it's to the benefit of so many people because he has done some writing on TV, Grey's Anatomy.
Yep. The Resident.
And also though, came out with a book last year.
Yes.
Called
I Can't Save You.
I Can't Save You. It's a critically acclaimed book. Like you go on New York Times, Washington Post, they've talked about this book. Fantastic memoir.
He's an excellent writer, a very creative storyteller.
Yes. He's also an award-winning storyteller with the Moth. We talked a little bit about that.
Yeah.
Hey, God, I really want to. We should do it. We should go to the Moth.
Do they have like partner Moth?
No, I don't know.
Can you do it?
Not.
I have only ever seen solo performances.
Well, we could just do
we'll
just do our own separate things. Our recounting of our story is quite different.
It's different. You don't remember any of the parts that I talk about, so
exactly.
I call dibs on those.
Exactly. All right, so we had a wonderful conversation with Dr. Chin-Quee. Should we get to it?
Yes.
All right, here we go. Today's episode is brought to you by the Nuance Dragon Ambient Experience, or DAX for short. This is AI-powered ambient technology that helps physicians be more efficient and reduces clinical documentation burden. To learn more about how DAX Copilot can help you reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discover-DAX. That's nuance.com/discover-DAX. All right, we are here with Dr. Anthony Chin-Quee. Tony, thank you so much for joining us. It's a pleasure to have you on.
Guys, I'm so thrilled. Thank you so much for having me.
This is really exciting, but I got to start with I've been thinking about this for a while now. All right. So can we, because you went through training in otolaryngology,
Mhm.
can we rank the five senses?
Oh boy.
Let's just get this out of the way. I'm an
Mhm.
ophthalmologist. You
Mhm.
trained in
Mhm.
otolaryngology. I feel like we got to do this. We got.
Okay.
Let's go.
Okay. Let's talk senses. All right. Let's refresh the five senses for everybody out there, maybe including me. So we got what? Sight,
Yep.
hearing,
Mm-hmm.
touch,
Yep.
uh,
Taste,
taste, and smell.
and smell. Yep.
Ooh, okay. So
Okay.
we're
Let's. Well,
ranking.
tell me what you would go with. We'll see how close we are.
I mean, if we're ranking as far as like which ones we think is like the dopest sense, or which one we
Yeah.
could not live with, like we wouldn't want to say we can't live without, but which one we
Yeah.
really don't want to lose,
Yeah.
or
Exactly.
okay.
Exactly.
I mean, personally, I'm a big fan of eyesight. And
Yeah.
I know
Yeah.
that, it's not part of my specialty anymore. Historically, it was.
Yeah.
But I'm going to go with eyesight at
Mm,
the top. Um, then I'm going to go with hearing uh,
mm.
because I
You
love the world
understand the
around me.
importance
And
of
I'm
the inner,
of the
outer, and middle ear. It's all
yeah,
very
all
important.
all the segments, and I'm a music lover and
There you go.
audiophile, so that's important to me. Um, I'm gonna go with smell over taste,
Okay.
because if you lose your sense of smell, you lose your sense of taste also.
All
So
right. They kind of go hand in
um,
True.
hand. There
they
you
go
go.
Yeah.
hand in hand. So
Okay.
I'm just gonna keep the smell if I can keep them. Um, I'm
And
okay
then
with touch being at the bottom.
being
I
five.
often think about life without the sense of touch and the shenanigans I could get into, but I don't know. I don't know. That's
But much
that's
higher risk of burning yourself and
Yeah.
oh
just
Injury.
generally just injuries or
yeah, you like feel awesome until like you have lots of festering wounds that you don't know about.
I
But
thought for
yeah.
Right.
sure we'd have some arguments, but I
Oh.
feel exactly the same
Oh,
way.
I don't.
Oh, really?
Yeah.
You're different. What are your five?
I
Yeah.
would still probably put eyesight at the top, but I don't know. I could do without smell and taste. Sure, take them. Like
Yeah.
just get
So
them
you
out of
probably have
here.
touch higher up.
I have touch higher up. And then, I was thinking I could do without my hearing because I get really overstimulated by noises. Like it's stressful to me when there's a lot of
Yeah.
noise
Yeah.
happening. But then you made the point about music, and I listen to a lot of podcasts and audiobooks, and I am a podcaster. So,
Kind of
that might be a
important.
problem.
Yeah.
I
I
mean, there's
mean,
workarounds, right?
of course, there's
But
workarounds, there's ways to make life wonderful with lots of
I've
any of these
just
things.
yeah.
I'm glad we could go through that because I've certainly had my fair share of arguments with otolaryngologists and about
Reasonable.
this. So I think we all have very valid arguments there.
Yeah.
I'm
I'd
glad
like
I'm
to be
glad
able to
to
turn my hearing down though. Like
oh
that'd be
yeah.
nice.
Just
Like a
kind of crank
hearing
it
aid,
down.
but in the opposite direction.
Well,
Yeah.
I think they have that. They're called noise
Earplugs.
canceling earphone.
Well, I have them.
Earphones.
That's why I use them a lot. You'll see me down in the living room in the
The
evenings with the
technology
family
does
around,
exist.
and
Wow.
I've
That's
got my
right.
noise
Exactly.
canceling headphones on, just being a mom.
You have just invented technology that already exists.
Wow.
No, no, I want to be able to just like turn my ears. I don't want to have to
Oh, where's
wear.
I see. I
Yeah,
see.
just
Well,
want to
Oh, you
turn my
just want
ears
to
down.
turn your actual ear down.
I don't think we
Yeah,
got that yet.
no,
Okay.
that'd be
But
nice though.
No, we'll
I'd like
work
to be
on
able to
that.
turn them all down a bit, except for my eyesight. I could
well,
turn that up a bit. I'm pretty blind.
yeah, that would be nice for you. So, Tony, let's go back and I want to just give our listeners just an idea of who you are, where
Sure.
you came from, your upbringing, that really kind of led you into initially a career in medicine.
Mhm. Okay, well let's do the short version, and if you guys find yourselves intrigued by any nuggets, you can
I'm
stop
sure
me
we
or
will.
just wave your hands around and we'll circle back. But yeah, so I'm from New York City. I grew up in Brooklyn. My family is kind of a West Indian immigrant family. So my dad's side is from Jamaica, my mom's side is from Trinidad. That's sort of uh, one of the mixes you'll see a lot of in Brooklyn, New York. A
Mm.
lot of West Indian immigrants there, but yeah, I was just always a smart kid, and in that culture that I come from, as is the case with many immigrant cultures. When you're the smart one, there's only a couple of paths that your
Hmm.
community expects
Yeah.
you to take. And it's not even like they pressured me. It's just that's all I kind of knew. It's just doctor, lawyer, engineer, those are the big ones if you're the smart kid in the
Hmm.
family. So I, went just gravitated towards doctor, medicine. I could do the math, I could do the science, and you know, kept that up through, high school and for college, I was at Harvard and I was trying to do all that stuff, just keep it going as well. Realized I really loved teaching while I was in
Yeah.
college. Did a lot of those programs, but kept up the pre med stuff, and then yeah,
Now, did you maintain this undercurrent of artistry? Because you like to write. Obviously, we're going to talk about your book. You love storytelling and entertaining, and so how did you keep that alive? Because that can easily get kind of squashed in medical education when you're on that path.
yes. Glad you brought that up because it did get squashed and it's very
Uh,
sad. On the way, like growing up, I was super artsy. Like I'm a very artsy, performy kind of guy. So I love playing music and acting and singing and dancing and all that stuff. I was in musicals, and in college I was in a cappella, of course, and just,
you're
held
telling
that
us way too
down.
much. We don't have any background music on this, so we might have to. I have a game for us to play later, but we may switch over to just having you acapella something
We're
for it.
just
Okay.
gonna we'll do the serenade. Yeah, but yeah, I love that stuff so much, and I didn't realize how much I needed it in my life until it started to get squeezed out. And especially when I went to medical school, and just you're around the hardcore science nerds, like
Right.
that's
Right.
where you're at, and you get to a point where um, if you engage in anything that people can deem a distraction from your studies, then you're kind of looked down upon. And
Mhm.
so the things I really love to do, I kind of had to put in a corner
Mhm.
and start keeping quiet. And that really started in med school, and extremely so in residency training,
Right.
where there were like actual consequences to, like, if they hear you were like reading a book for pleasure and instead of studying,
Right.
that goes on your permanent record. So it's
Right.
super cool. So yeah, I don't do anything fun anymore. But yeah, it's just those are parts of me that were always really important that
Yeah.
I had to start neglecting in order to succeed in medicine. Which I didn't realize just how much it was harming me until, the medicine wasn't enough and I was really struggling.
Yeah, and I wanna explore that a little bit because residency is no matter what residency program you're doing, it's challenging.
Mhm.
It's very, very difficult and can lead you to a dark place in life at times. And, uh, and so what was it that kinda when did this if there was a switch that flipped that kinda told you, "Okay, I need to either leave medicine or I need to I need something to change to allow me to explore that artistic side of my life that's so important."
Mhm. Well, for me, it was like I remember it's a very specific moment, and it was in the middle of residency, and it was kind of at my rock bottom of residency, not just because of the workload and the lifestyle, the experience of residency, but also like I've lived with chronic depression my whole life, and it kind of I haven't always managed it. I haven't always known to manage it or how to. But over the course of my life, I've had these really intense periods of being really depressed. And I had one of those periods halfway through residency training, to the point
Uh,
that I was just, barely showing up at work. And, I failed my step three, which you're really not supposed to. And it's like,
yeah.
typically, people can pass and not worry about it, but I didn't study at all, and because I was so, outside of myself, and
And this is
you know,
this is surgical residency. How many years is otolaryngology? It's like 6 years or something?
it's
It's a
5.
long residency, 5 years?
Yeah, yeah. So it's long.
Ugh,
Yeah. So this
yeah.
is second year, start having this stuff, and then at some point, After I failed step three, they told me that I couldn't work anymore until I passed it. And so I was given this
Ugh,
indefinite leave of absence. And during that time, I really had to figure out like what it was that I wanted to do with all of this. Like, what was I killing myself for? And then I remembered just how much I loved telling stories. And I
yeah,
really always have, in whatever capacity. And I've always been told that I was pretty good at it. And so I was just like, maybe what I'm going to take out of this experience is uh, this story that I want to tell. And I want to tell a story about residency and about training that doesn't sanitize kind of what it is, what it has been for me, and what I know it is for lots of my friends who are going through it. Because I realized I'd never read a book like that takes the chance to make the author, the doctor, look bad,
Mhm.
and
hmm,
and really talk about the really difficult and grimy parts of training and the grimy parts of ourselves that we find along the way. And I just thought that honesty could be really helpful to other folks. And so from that point, I kind of use that as my guiding light, at the end of the tunnel to get through the next couple of years, and just started
yeah,
just taking note of like moments that I knew were formative as they were happening, and just like writing them down, or when I'm dealing with something and like songs come to mind, I start writing the song down. I took a lot of photographs, that I felt were emblematic of the moments that I was going through, and didn't know how it was all going to come together. But just the act of tapping back in
right,
to you know something that's really helped me understand the world, this my artistic side, was enough, to kind of pull
yeah,
me through.
Yeah, it's interesting because then you're not just doing residency anymore. Now you're doing research. Now you're in a project.
Yeah.
Now you're living your story that you're gonna
Mhm.
be writing.
Yeah.
So you're doing what you're doing for the story, not just for, the piece of paper at the end. So
Mhm.
that's kind of interesting. I think a lot of people I didn't go to med school, but I did go to a really rigorous grad school program and decided halfway through or a little over halfway through that was not going to be the life for me. And so I get it. A lot of people in med school, I think, similar thing, or even during residency, or even out when you're out and you're practicing and you're like, you know what, this is just not the life for me. It's either not what I thought it was, or it's just not for me anymore. And then it can feel so bleak because so much goes into it, and there's so much, shaping not just of your skills, but of your mindset and your beliefs about the world. And like what you're saying, like if you're reading for pleasure, that's somehow bad. Like you get into these
well, you could
twisted
be operating,
mindsets because yeah, exactly.
instead.
Exactly. So it
Exactly.
feels like there's too much to lose to be able to do anything else. And then that puts people in these really desperate situations that sometimes, don't turn out well. So um, I think it's so powerful to hear stories like yours of somebody that says, you know what, I have medicine, but medicine is not going to be enough. And so what can I do?
Yeah, and I think it's just, it's the fallacy of sunken costs, right? I mean, you
Yeah.
put in so much time and money, the hundreds
Right.
Hmm,
of thousands of whatever,
And a sense of
whatever debt I
identity,
have. And
even.
yeah, it's like in this particular profession is it it becomes part of your identity, for
Right.
better or worse, and to consider walking away from it. And I've talked, because I've kind of become this patron saint of doctors who leave, and I've
Yeah.
gotten a lot
yeah,
of people reach out to me and call, and just like, is it okay, to walk away, or
Right. Is there
yeah,
life
and
after medicine?
yeah, and it's just like, you got to remember that there's no experience that you go through that is a waste. You didn't
Right.
waste those years. Whatever you
right, yeah,
gained from that time, you're going to bring to whatever else you choose to do. And it's such a rich and unique and important experience for you, that you're going to make, whatever it is you go into next, really meaningful because of it. So don't worry about, don't think about it as, I wasted all those years and all that money. Like,
Right.
what you got to worry about wasting is, the life you have left. I mean, it's
hmm,
just, you know, we talk about depression, and, we don't have to get dark, but we can be real. Like, I
yeah,
dealt with suicidal thoughts, and, really, honestly, I think I'm alive just because of luck a lot of the time. Like,
Mhm.
there were times when I was just very careless with my life when I was really depressed, and that was kind of how I engaged in it. And a lot of times when that carelessness really could have gone one way or another. And then when you come out and the fog clears and you realize, like, man, how flimsy is all this stuff? How quickly can
Mhm.
it all get taken away? And am I going to spend these minutes, these moments, you know, not trying to be happy or
Right.
not trying to be fulfilled? I mean, we all deserve it, and the profession shouldn't make us feel like we don't.
Did you have people along the way when you were in residency that you felt you could reach out for help, or that tried to help you? Or did that not really exist where you were?
Yeah, so I think it was difficult for me where I was because I was in Detroit. I'm not from Detroit. I don't have any family there.
Mhm.
A lot of the people in the Midwest and in those programs are from the Midwest. They have family kind of
Yeah.
nearby. Um, I
But
didn't.
even in the medical, like, in the hospital,
Uh-huh.
like, you're.
Yeah, I had friends, but I didn't. Well, I didn't trust them. That's kind of a it's kind of a trick that residency
Yeah,
plays
yeah.
on you,
Mhm.
like, I didn't, especially, like, people in my program, I didn't trust them to know things about me because I thought, "Is this just gonna come back around? They're gonna talk, the world is so small." And my friends who were, in different specialties, um, we were all in tough places in one way or another, and so, I think what we mostly used each other for, were distractions.
Yeah,
That's the
right.
easiest way. And so we didn't dig into the stuff that all of us in some way were really struggling with because we didn't have time. We were tired. It's easier just to get drunk and, do silly stuff,
Which is probably
instead
not
of
the
getting
the
real.
best thing you wanna do having
Yeah.
when you're depressed, right?
Yeah.
So
But yeah, none of
it's like
us,
a Band-Aid,
we all think we're smart enough to outsmart
right?
ourselves.
Right.
So
Oh,
yeah.
Well, it's so
So
tricky too because
it
in
wasn't all me.
medicine and especially during residency, there's this culture that you can't have a weakness, you can't have a sick day, you can't have anything wrong with you because if you need to tap out for a bit, all that does is put more work on everyone else around you. And so, how could you? I think it takes a very special environment and a very intentional culture to be able to create a culture where you can go talk to your fellow residents or your program director or whatever and say, "Hey, I'm having a hard time." Because if you don't intentionally create that, then you're just making life harder for everybody else if you need a break. So I can see how it feels like you have to keep that to yourself, because what option do you have?
Hmm.
yeah. And so you started to explore, you know, be yourself for the most part. You had this opportunity. At what point did you say, I need to leave. I need to stop, get out of medicine.
Well, I think it was, well, I started my first job after residency. And I knew within a few months that, okay, I'm not staying at this job forever. Like, just
Yeah.
something about the clinic to OR to clinic to OR for the rest of my life. I couldn't do it. And so I stayed there for 3 years, and then I quit, and I was thinking, maybe I need a different venue, a different
Mhm.
Mhm.
institution, just to keep doctoring, and looked for some opportunities. Nothing was quite panning out. So I was just going to take some time, and, I had my savings. It was all good. And then one day I saw this advertisement on Facebook to be a medical advisor for Grey's Anatomy, and, like, as an intern,
Yeah, yeah.
and I was like, "Oh, I'm quitting my job. I'm gonna have a few months to myself." So,
It's
and
like,
I
I
live in
just did an
LA.
internship. It can't be any worse than
Yeah.
that.
Yeah, so I was just like kind of, girding my loins for internship number 2, whatever that may look like, and it was just the coolest thing because it was basically me in the writer's room of Grey's Anatomy helping the writers put the medicine into the show,
Yeah.
because the writers don't know it at all. And so, just to be around that, and I had no idea that that was a profession really that people could
Right.
do. And I was just like, what if I, like, want to do this? Like, can I get
Yeah.
down with you guys? And it was the great thing, like they have such a great writers room, and a lot of the writers there have had full careers in different things before becoming writers. And so they were really warm and helpful and kind of gave me tips on what to do and what classes to take and all this sort of stuff. And so, I started chatting with some folks, started writing on my own, and ended up getting a job as a writer on The Resident when it was on the air, and just not even just a medical consultant, but an actual
Oh, really?
episode
Oh,
writer
yeah.
Oh,
on the
wow.
show.
Oh, that's
Yeah.
cool.
And so I was just like, okay, this is awesome. I kind of love this. And what if I just do this? Let's just do it and see what happens. So yeah, that's when I was just like, you know what?
Did you have to move
I'm
out to
jumping out.
LA for this, or were you?
Well, when I was my job that I had was in Los Angeles.
Oh, okay.
So
All
Okay,
right.
you were
I was
already there.
living
Yeah.
there. Yeah, and it was kind of like it wasn't by accident that I got my first job in Los Angeles. I kind of was just, rolling the dice. I was like, "Hey, I haven't lived there before. I'd love to live there." And it's near this entertainment industry.
Yeah,
And
yeah.
I don't know
Mhm.
what may come out of it, but let's just be nearby.
You were intrigued
Um,
by it. Yeah. You're like,
yeah,
maybe, let's see some opportunities could
yeah,
come up
yeah.
there. So,
So
and it
it
did.
worked out. And
That's awesome.
when people ask me if I miss it, it's just I answer so quickly that I don't. Um,
Medicine, you mean?
Not a
yeah, if I
bit.
miss medicine,
Yeah.
like it's
Yeah.
just I'm just fine.
These
With
these medical shows though, they still struggle with the chest compressions.
Yeah.
I'm just
Yeah.
saying, like it's
There's a few
I'm
things
sure you've
they
been banging your
still.
head
uh-huh.
against the wall at times. Like, come on, we did it. Pick up the pace here a little bit.
Yeah, no. Well, here's the fun thing about writing on medical shows and when you're a doctor is that you got to figure out where you want to draw your line, right? Because one thing about being in writers' rooms with creative people is saying, no, you can't do that isn't a helpful thing to
Right.
add to a conversation. So, what you're always trying to do is be like, okay, let's see what you want to go for emotionally, and I can see what I can do about helping the medicine meet you there. And then, you got to do things like compress things for time, or
Sure.
like labs that may take 4 days to really come back. You got to get back in 2 minutes. And, this doctor, because we only have so many doctors in the hospital, has to be both hospitalist and surgeon and
Right.
palliative care. And
It's the
let's put it
House MD
together.
model. Yeah.
Yeah, yeah, the
Yeah.
house MD.
Yeah.
But I always thought about it as like, okay, as long as we're not being irresponsible with the messaging, then we can, if we gotta gloss over some specifics that only, the people really in the know are gonna notice,
Mhm.
like it's okay. Because if we're teaching people about, these are the important things you have to know about being a end stage diabetic, or, teaching people about, we had this episode that I did where we're talking about uh, fat shaming in a hospital from your
Mm.
doctors, and how that can affect your health and how you have to advocate for yourself. Like that's the important part of it. And if we gotta, gloss over
Fudge
the
the
little
other
stuff,
stuff.
like there's a whole bunch of intubations that are just sloppy. But
Yeah.
I'll be like, you know what? It's
Yeah.
okay. Let's keep it moving. I don't want to stress everybody out. Let's
You
get to the
can't.
wholesome moral of the
Yeah.
story.
You're not
Yeah.
actually doing surgery. You're just making a TV
Yeah.
show.
I
So
mean, and
yeah.
Yeah,
you
yeah,
can't wait 72 hours for culture results to come back and
yeah,
sensitivities, right? So, and
yeah. After the commercial break, we got
and so,
that.
if you every now and then you might irritate like an interventional cardiologist out there somewhere, but
Yeah.
it makes
You
a lot
know
of
what they
sense.
do get right though is I've not once ever seen an ophthalmologist in an ICU. So
That's true.
they are doing that
Have you
right.
They
written any
know that they
ophthalmology stuff? Any eyeball stuff?
I try. It's hard to get ophthalmologists onto TV, and that's something I hope to rectify in my
Hey,
May I
career.
present one
hey,
to you?
reach out. I'm
Yeah,
I'm
well,
happy to help.
we gotta. I was like, listen, I know a guy. He
Yeah.
Look,
knows the
look,
eyeballs. He'll just pass through. He'll be great.
I'm saying if we could just, I would love to get some representation of eyeball
Mhm.
land
I
in
think it
Mhm.
in
matters.
in
We don't
in
want you
the
guys slipping
pop
through the
culture.
cracks. Yeah,
It's- at
absolutely.
least at least just to help people understand what an ophthalmologist is. That's all. That's
Mhm.
that's
That
like
could be
bottom
something.
line. Let's just
I thought you were going to say Visine, but
Oh, I mean, if we could have a there you go, have a Visine poison patient. That I
Oh.
don't know if House ever did that, but
Yeah, I don't
you
know.
know, that's like a true story. That's like something that actually
Oh,
happens.
I
man.
know.
Anyway, all right, let's take a quick break. I want to come back and talk about storytelling, the Moth, all the work you've done there. So we'll be right back. Hey, everybody. Old news, but good news. We're coming back to the Irvine Improv on Sunday, March 24th for our show, Wife and Death.
That's right. We're going to talk about the time you died.
And came back to life.
It'll be a tragic comic, multimedia, memoir, stage show extravaganza.
And some of my characters might show up too. You'll just have to come and check it out and see for yourself. To buy tickets, click the link in the description below, or you can visit glaucomflecken.com/live. We'll see you there. Hey, Kristen.
What's up?
I got to tell you about Precision.
Tell me.
This is really cool. It's the first ever EHR integrated infectious disease AI platform.
Well, that sounds interesting.
Yeah, it's for any specific patient, it'll automatically highlight better antibiotic regimens.
Okay, so it can maybe help you treat the patient better and then also gets at this antibiotic stewardship issue.
Exactly. It basically empowers clinicians to save more lives while reducing burnout, just making their jobs easier.
Nice.
To see a demo, go to precision.com/KKH. That's precision spelled with an X instead of an E. So prxision.com/KKH. All right, we are back with Dr. Anthony Chin-Quee. And so, Tony, tell us, I'm fascinated by the work you've done on the Moth. You're an award-winning Moth participant. Is that what
Storyteller.
storyteller?
Yeah, award-winning storyteller. We could.
Yeah. I think that's awesome. So give us a little insight into, well, how'd you get started with the Moth?
Yeah. So I got started. I sort of have two parts of my life that have been Moth related, and the first one was actually back in residency, back in Detroit. Like after I had my realization that I kind of told you guys about, that I needed art back in my life, I was like, okay, where can I find it in this city? Is there anything to kind of tide me over? I was like, let me go to like this open mic or like this and that. And then I heard about the Moth, which is just a storytelling competition that's held once a month in pretty much every major city in the country. And it's usually at a cool lounge or bar or whatever. And you go there and you put your name in a hat, and they pick 10 people out of the hat, and you have 5 minutes to get up on stage and just tell a story, hopefully on the theme that they chose for the night. And I heard about this, and I had never been to one before, but I was like, you know what? I'm going to try to get on stage. And I am going to pick a story, and I'm going to practice it so that it sounds spontaneous when I do it live,
Right.
because that's how I like to be spontaneous, is very
Yes,
well rehearsed.
prepare to be
So,
spontaneous.
yeah. So I went and I invited some friends, and I got up there. Another buddy of mine got up there too, and we told these stories, and it's just the best. And just this little crowd, and just everyone's normal. They're laughing. We're having fun. Some folks cry during like these stories. Like they run the gamut. And so I did that one, and like there's a little competition at these local ones, and I came in first place in that one. So I got invited to the All Detroit once a year slam, which was
so cool.
just awesome. Like it was at the Fox Theater in Detroit, and just sold out, big theater, and it was beautiful, and it was so much fun. And so just the
You were
idea
hooked.
that I was hooked. Yeah. And
Do you get to keep developing the same story as you move up through the ranks there, or do you have to come up with a different story every time?
well, now that I've actually in the last year since my book came out, like my publishers got in touch with the Moth people, and they were like, "Hey, like, what if you come back and you tell the story from your book?" And so I adapted one of the stories from my book to get on stage and tell at what they call the Grand Slams. So basically, it's like they're best of the best storytellers. They go from city to city, and it's always a big fun deal. It's usually just like 5 people, and I've told my story 3 times in 3 different venues, and same story, but
Mhm.
as you perform it, you kind of figure out what works. It's like refining, stand-up
Right.
material. You know what I mean?
Right.
So by the end, by the last time I did it, I was like, all right, I'm really like rocking
Yeah.
this at this point. And there's some folks who tell the same story like 10, 12 times.
Yeah.
Just they take them out on tour and people just love it. And the only time you're forced to stop telling one story is when they kind of retire it, when they put it up on their podcast.
Right. Because then
And
it's
so everyone
out
hears
there.
it. So you got to come up with something new. But it's
And
just such a wonderful organization. It's so sweet.
the idea is that these are, I mean, they're, you prepare for it, but they're not like, you know, you don't memorize it and rehearse it over and over again. And isn't that like, you don't want to, they don't want you're reading the story, right? It's
Right.
it's
Yeah.
it's
So
got to
no one
be kind of
ever is reading the
extemporaneous.
story, but by the time, like, if you're telling the same story a lot,
You
you
got it.
know
I
the
mean, it's
story.
your
Yeah.
story,
Hmm.
And
right?
so,
And
yeah,
you know
it's
it.
just like, and just, but they don't want you to feel stilted. They wanted to
Sure.
feel like a conversation, like you're around a campfire. And so you kind of maintain, that sense of kind of playfulness with the
Yeah.
audience and
Hmm.
kind of staying loose out there. So,
I've
yeah,
I've
it's
never
awesome.
been to a Moth event. I'd love to go.
Yeah, we should
They
go.
have one in
It's
Portland?
I'm
I
sure
don't
they
know.
do.
I don't know. They probably have something.
100% they have one in
Yeah, it's
Portland.
it's a
Yeah.
bigger literary city than than you might think.
That's true.
It's Portland. If it like
But yeah,
Yeah.
they've
it's
got
crunchy
all
over
sorts of
there. You
arty
guys
stuff.
got that
Yeah,
It
stuff.
is.
it is quite crunchy.
So how did you so did you, I guess, springboard from doing that into writing a book? How did you, at what point were you like, "Oh, I got to just write all this down and publish it?" Like what's
Yeah, so the book stuff was also an idea I had in the middle of residency. And so all the notes and things I was taking for the next, few years, I was like, I think I can make something out of this. And so after I graduated, I just started writing it from the beginning and I didn't quite know what it was going to be. I was like, is this going to be like an expose of, medical training and how trash it is, or is it going to be something different? And I realized that what I wanted to do was tell like kind of a much more personal story about my journey through and hopefully, by making it real specific, I could make it ultimately more universal to folks,
Yeah.
if that makes sense. And so I started writing in 2016, and the book came out in 2023. So it took a really long time to write it.
Yeah.
Yeah,
How did you decide whether to go like traditional publishing, self-publishing? I think a lot of people are thinking about writing a book these
sure.
days. That's a big question.
Yeah, I mean, I think self-publishing is always an option. But I think we all want to try to get in with a publisher who can use their money to try to sell your book
Mhm.
instead of your own. But the process of getting there was pretty long. I mean, this first step was finding a literary agent. And me not knowing anybody in the literary world, I just looked up how to do it on the internet, and it
Is
was
there a
just
YouTube video
basically
for how to
Yeah,
find a
just Google
yeah, there's
Google it.
like there's quite a few, and it's just basically learn how to write a little letter talking about
Yeah.
you and the idea you have for your book, and if you've written any of it, you attach that bit, and then you just send out blind emails to folks, and see if they get back to you. And oftentimes, agents either get back to you in like 3 months after you send it, or they never get back to you at all. And so
Yeah.
you just keep throwing it at the wall and seeing what sticks. And I think I was looking for an agent for about a full calendar year, just getting the rejections.
Oh,
And I think
wow.
like sent query letters to about 60 or 70 people. Um, and
It's like
then
applying for
one,
residency.
yeah, it's just you
Jeez.
throw it
Yeah.
all at the wall, and you try not to let the failure get you down.
Oh,
But
man.
yeah, there was one agent who really connected with it and thought it was cool, and we just went from there.
Man.
Very cool.
Yeah.
I have, you know, dreams of writing a book one day, but I don't know when I'm going to do that.
Podcasting keeps getting in the way.
Yeah, parenting, little things.
Just a little stuff, no big deal.
Yeah.
But yeah, I mean, that's the thing, you know, the only way, like, yeah, there's all the the
You can find
logistics
reasons
of how
not
do I
to,
get,
right?
yeah, how to
Yeah.
do it and how to find an agent, all that stuff. None of that matters. You just got to write something, you
Yeah.
know. And it's, you know, you make it a practice, write a little bit or think of some ideas, you make that your give yourself 5 minutes, 10 minutes a day and just see where it leads you.
Are you
Yeah.
still writing for TV? Are you?
Yes. Well, at
Yeah.
least attempting to.
Yeah.
Where I'm attempting to work on the television adaptation of my book.
Oh,
So
that's
I'm
great.
hoping that we have some cool news to share about that sometime
Yeah.
soon.
Awesome.
But last year was the Hollywood writer's strike, which was just a wonderful and stressful time for everybody, just being out of work
Mhm.
for 5 months. And now
Yeah.
that it's done, it's even harder to find work. So it's a challenge, but I'm still trying to come up with my own ideas, things that have nothing to do with medicine and stretching my wings, as a storyteller and still love it.
Who do you want to play you in the
Ooh, good
TV show?
question.
Oh man, it's just, take your pick of just the most handsome and charismatic people.
Yeah,
I
that's
don't
I
know.
think
right.
you should go straight for Denzel.
I
I
mean,
mean, yeah.
like it's funny because
I'm
like
sure that's a possibility.
we grew up and kind of I think in our heads, in at least in mine, Denzel is always kind of like 30 years old and like just
Yeah,
still
yeah. You just
handsome
stuck
and just
there.
nailing it.
Yep.
And he's not like the 70-year-old guy who just is making
Right.
it look easy. But I mean, if Denzel wanted to give a take at it, you don't say
Yeah.
no.
That's
I would
right.
welcome
It could be
him
a
to the stage.
retrospective, him telling the
Yeah.
story. Yeah, yeah,
There you go.
Yeah, you
That's
go
like-
Denzel or bust. I think that's very smart.
yeah.
The way to
Shoot
live your
high.
life.
So the book is called "I Can't Save You," and you've bef- before we start wrapping up, you shared with us a few stories just from your life because we like to tell stories in this podcast, um, and so you have one it's in your book if you wouldn't mind sharing about your first day as an on-call intern.
Oh, yeah. So this is a fun one. Let's see if I can do this quickly. So yeah, my first day on call was the 4th of July.
Oof.
And so
That's
I
terrible.
had
That's a
That's
terrible first day
yeah.
on
That's
call.
just
Oh
right
my
into the deep
God.
end.
it is just into the deep end, and I'm just like, cool, the most explody and fiery
Yep.
holiday we have. Just
Oh
get me in
man.
there. And I was on the plastic surgery service. So plastic surgery in the hospital means in addition to face stuff, they also take care of hands sometimes.
Mhm.
And we were the hand specialists for the day. And I got a call from the ER while I'm, hiding huddled away in my call room, like willing my pager into silence. And they call and just like, yeah, we got this guy with a dislocated finger, was riding his bike, he fell off. We can't get it back in. We've tried, we've had attendings try to pop it back, we've had other people. We just figured, now's the time for the hand specialist. And I'm just like, I mean, yeah, sure. You should totally call the hand
Yeah.
specialist. What are you calling me for? So, but so hand specialist was me. And I was like, cool. Never seen a dislocated anything in my life.
This is
Um,
gonna go well.
and so yeah, so I was like, but they want me to try. And I was like, well, is this one of those times when I just call my senior resident who's clearly out at a barbecue to come into the hospital and like help me
Uh-huh.
do my very first consult I've ever got?
Yeah.
And I was like, you know what?
Like 0 for
Absolutely.
1.
Yeah, I
Yeah.
was like, you know what? Absolutely not. I'm a step up right now. What's the worst that could happen? Like he'll continue flapping in the
Yeah.
breeze. So
Yeah.
I
Just
got
have a
on.
wonky finger for a while.
Yeah, he'll
Yeah.
have a wonky finger, no big deal. And so I got onto YouTube and I just typed in
As
how
one
to
does.
fix
Of course.
dislocated finger. And I studied in a YouTube rabbit hole for a solid 10 minutes and
Yeah.
just went downstairs. And I was just like, just giving off the aura of
Mhm.
someone who
Confidence.
knew what they were doing, because that's the most important thing is just, appearing confident, even if you don't know
Oh
what
yeah.
you're doing. And so I went in and I, numbed it up. I just went through the steps in my head so many times.
You set the
Managed
laptop down next to the
Yep,
patient,
Yeah, I was
started
just
up
like,
the
hold
I'm
on a
just
minute. I
YouTube
gotta get the
video.
right
going,
tab
no big
going.
deal.
Yeah.
But yeah, I went in there and I just like was holding my breath the whole time, like trying not to poop my trousers, and managed to pop it back in.
Nice.
And the guy knew it immediately and he loved it. And I was like, hey,
That's a
I
win.
knew I was nailing. He just gave me a big hug and I like held on to him like inappropriately long. And then just like as I was leaving, I was like saw the attendings who had like failed. And I was like, hey, man, everything worked out fine. Call me if you have any questions.
Oh, got cocky.
At that point, you were thinking, oh, this medicine stuff isn't that
Yeah.
hard.
Oh, I'm going to
And
breeze
I
through
love
5
that
years
it
of
did not
this.
come from the Harvard education. It came from YouTube.
That's
It came from
The
right.
YouTube.
knowledge.
Absolutely. So yeah, that was my first day as a doctor responsible for other people.
Oh, that is hilarious. I bet that happens so much too. I wonder how much of medical education these days is actually
Well, I
YouTube.
mean, I remember stories from my attendings in residency who were, they trained probably 20 years ago or so, but they had, actual textbooks
Right.
open,
Yeah.
like while doing procedures, like minor procedures. So, I mean, it's just a newest version of that.
Exactly.
So,
Yeah, that's it.
and to everybody listening who might be horrified
Right.
that this happened,
Right,
Let's
rightfully
not-
horrified. This is not a good thing you want to hear about
let's
doctors.
just keep in mind, like, this was not a life or death situation.
Yeah.
There's appropriate supervision, especially in July.
Yes.
They get a
There's
lot
of people looking out
because
for you, yeah.
again, like I was my first rotation was ICU as an intern, and I started on nights.
Good
And
for
can I
you.
remind you, he's an ophthalmologist.
Yeah.
Now at that point, I did have some
You had some brain smarts.
I had some general medical knowledge
Yeah.
still rolling around inside my head. But
Yep.
the other story you shared with us, Tony, was just which made me laugh out loud alone by myself. Was a story about just how poor you were in residency.
Mhm.
What did you?
Yeah.
We
What
can
did
all
you do?
relate to that. Like, it
Oh,
does not
God.
pay well.
Yeah, it doesn't pay well. And I wasn't from a family that learned much about money management. And
Mhm.
so I was living above my means and also, well, just completely broke, redlining the old checking account. And so I was at the point sometimes where, to pay for a gallon of gas in my car to get to work, I was out of money. And the debit card was an overdraft. So I had to pay in loose change for gas. And so I was like, cool, let me, find, enough quarters and dimes and whatever. But, for some reason in my travels around the country, I had a jar of change that I just always kept with me.
Yeah.
But it was also like my jar of thumbtacks that I also kept with me whenever I moved anywhere. So I just
Naturally.
kept them
Sure.
together because that's
Makes a lot of
naturally where I
sense.
did it. So when it was time to pay for gas, it was just basically reaching into the thumbtack jar and painfully and bloodily pulling out loose change, which I would then slap onto the gas
Counter.
station counter in shame.
Yes.
But you get a couple gallons in your car, and you can pretend to your colleagues that
I'll
you're
tell
not
you
dirt
what you
poor.
could have used that money
Yeah.
for: buying a separate jar for your
A
thumbtacks.
That's
second
right.
jar. Yeah, no, that's
As-
the kind of foresight that came to me only later on in adulthood.
Yeah. Although I would argue it might be a good money management strategy, because then you've got to really need
Yeah.
that money
You gotta
to be
need it.
willing to go surfing through the bucket of thumbtacks
Oh, that's good.
to access it.
Yeah,
So
Yeah.
just
it's a little bit of
causing
like
yourself physical
classical
pain.
conditioning there for
Yeah, and it's like
saving
it's
your
just-
money.
Yeah, I mean, I wasn't even thinking straight. I wasn't like, oh man, I really should get a tetanus shot tomorrow because I don't know how long these
How
Where's
thumbtacks
many
this money
have been.
been?
thumbtacks did you need? What were you
I
posting?
mean, when you move and you take all your thumbtacks out. This is back when I was in young man mode and all my artwork was just posters.
Posters,
of
yeah.
the Bob Marley, all that stuff.
Mhm.
So I just had a lot of thumbtacks.
I'm just
And-
imagining thousands of thumbtacks in your house, in your apartment,
Yeah.
just
I was
holding up
tacked
everything. And
Oh yeah, yeah. No, it
that
was
that,
really.
that bookshelf behind you, it's hard for me to see, but I think there might be a lot of thumbtacks holding that thing up.
Just
So
countless dozens of thumbtacks.
Mhm.
Yeah, so that's
Oh,
my painful
that's
story.
such a great story about. I mean, because we could relate to
Oh, yeah.
just not having any money, and you're already in, at least in our case, $250,000-$300,000 in debt.
Right. Student
Yep.
loan debt.
Yep.
and- Yep.
It's
Yep.
like trying.
Mhm.
I still remember the during my orientation of med school, we had a financial aid presentation, and he was asking, or the big financial aid advisor was asking like personal finance questions and would throw out ramen packets to people who got the right answer.
Oh,
And
wow.
I remember thinking,
Mixed
I am
messages.
about to go in $200,000 in debt. This is going to save me. This
Ramen
is
noodles.
this is what it's gonna take. Yet
Yep.
I did it. I was so excited. I got one of those packets, and
No, I'm so glad
Probably
you
ate
did.
it.
it was my dinner one night.
It's
Yeah.
So
delicious. Yeah. Oh my gosh. The things we go through.
I know, right?
Yeah.
So tell everybody, where they can find your book, and anything else you
And
you
what
want
you're
people
up
to
to
know.
now
Yeah.
that it's published.
Yeah, no. So the book came out in April of 23. So it's available wherever books are sold, at your local bookstores. Try to support them. Also, if you're an Amazon Barnes Noble person, go buy it there too. It's there. The audiobook is also available. I hear it's very good because I do the narration.
Oh, you
Oh,
did? Oh,
And so,
good.
yeah, that was super fun. And I've heard that people dig it. So if you want to hear me tell you about my silly life,
How
then
long did that
do the
take?
audiobook. That took about a week in the studio.
Okay.
We did like 8-hour
I've always
days,
wondered
and
that.
8 hours of just reading your
yeah,
own
just
book.
your
Yeah.
own book, and just hearing yourself mess up words like
Yeah.
linoleum. Because I realized, like, wow, that's maybe the word I say the most in my book is linoleum. And you hear yourself say linoleum enough times, you start
Right.
to think you're
It
going
like
nuts.
stops being a word
Yeah.
in your mind. Yeah.
It's like, did I make this up?
Yeah.
Yeah, it felt weird, but yeah, it was like a week in the studio. It was a lot of
Oh, that's great.
yeah.
And are you and so what are you up to next? What's in store for you? I obviously have the TV show you're trying to get off the ground.
Yeah, trying to do that sort of stuff. It's basically I'm just working on creative stuff, trying to get some new things off the ground. So hopefully this year will be a fruitful year in that regard. And there'll be fun news upcoming.
Do you spend any time on social media?
I
Or do
do.
you try to stay away?
I don't participate in it all that much, but I'm
Gotcha.
I'm always lurking. So yeah, I am on the X/Twitter. I'm at CQ _ MD. Or if you just look for my name, Anthony Chin-Quee, I'm there. And I'm also
I'll
on
find it.
Instagram. If you look up my name again, Anthony Chin-Quee, you'll find me on there.
Great. And again, the book is I Can't Save You. Definitely go grab it, and it's fantastic. By the way, like people are like raving about it. The reviews of this book. So congratulations on all the success from that.
Thank you so much. It's so wonderful. I'm just glad people are finding it and relating to it.
I think you got a story that a lot of people can relate to. I mean,
Yeah.
especially not just people in healthcare, right? Not just people in medicine, but a lot of people can relate to your story. And as far as medicine goes, I mean, it's a tough time right now, right?
Mhm.
Morale is like, I feel like it's never been lower just
Yeah.
among healthcare professionals. And so,
Yeah, we need to see some examples of,
yeah,
how can you take your medical degree, experience, education, whatever it is that you have, and use it to make your life whatever it is that you
or
want your
just,
life to be.
yeah, just find yourself and what makes you happy, and
Yeah.
Yeah.
be true to yourself, and all of those things, just awesome lessons. And so thank you for putting that out there.
Oh, thank you. Thank you for having me. Thank you for all you guys
Yeah.
do. I follow all you do. And I think your journey to this point has just been so wonderful. It's wonderful to see. And I'm glad that you're giving back in all the ways that you're trying to. It's just
Thank you.
great. So thank you guys for all you do.
I don't have an otolaryngologist yet as a character. I'm still working
Ooh,
on that.
Yeah.
So
it's a
Maybe
tough
you
one.
can
People
have
don't
him
know who
write it
we
for
are.
you.
exactly.
You need to collaborate. Have him
Yeah, I
write it for
know.
you. Yeah. There you go.
That's right. Yeah, I'm talking to a writer right here. So,
There
all
you
right.
go.
Well, thanks again for coming on, Tony. It's a pleasure talking to you.
Yeah. Thank you guys so much. Have a great one.
Hey, Kristen,
Yeah.
how many mites is too many mites?
For me, 1.
Well, I have 8.
That's way too many.
That's a lot of mites, right?
No one wants that many mites.
You know where you find these guys?
I'm afraid to know.
On your eyelids.
Yeah. Oh, I don't want that.
I know, but like if you ever have red, itchy, irritated eyelids, or if you get a crusty, flaky buildup on your eyelashes, Could be because of Demodex blepharitis.
Ugh, no,
It's caused by these guys.
I don't know. I don't
Demodex
want it.
mites. It's just a thing that happens. They're usually not this big, though.
Well, that's good.
Usually.
Usually.
They're much smaller than this, but they can still cause major problems. And so you need to go get it checked out by an eye doctor.
Okay.
Don't get grossed out.
Get checked out.
Get checked out. All right? Don't get grossed out. Get checked out. To find out more, you go to eyelidcheck.com. Again, that's EYELID check, CHECK.com to get more information about Demodex blepharitis. Well, he just makes me want to go out and tell all the stories.
I know. It's very inspiring for people like us that are kind of artistically inclined anyway. Like, it just makes me want to go do all the things.
I know, I'm always preaching about that, right?
Yeah.
Like, just, you can't, it's so easy to lose yourself in medicine.
Yeah. Well, I don't think it's an accident. I think they take it from you.
That was definitely one of the lessons there. So we take a look at a story.
Yeah, let's do it.
All right, we got a shout out to Knock Knock Eye in this story. These are the eyeball specific episodes we've been putting out every week.
Yep, on Thursdays.
This comes from Haley, who is a PA working in HEMONC, so physician assistant working in HEMONC. Hematology, oncology.
So blood cancers.
Yeah.
Okay.
Yeah, basically.
Okay.
And something she learned on the Knock Knock Eye corneal abrasion episode. She said, we had a patient in the hospital for inpatient chemotherapy who reported sudden loss of vision. I was able to test the vision with more than just a vision chart and by holding up fingers, something I talk about. I followed the steps you outlined, and this patient had complete loss of light perception. Turns out he had involvement of his lymphoma invading the optic nerve, which is like a big deal.
That's
a
you
very,
need
very
that to
difficult
see.
thing.
I do know
He
that.
surprisingly responded well to high-dose steroids, which is one way to treat it for sure. Our ophthalmologist didn't come to the hospital.
Naturally.
But we transported the patient to our local ophthalmologist's office for an additional exam, which is fantastic service. You do get a better eye exam in the eye clinic. I will say that.
Right, because you have all the fancy equipment there to look at the eyes. Is that why?
That's exactly. We have a lot of equipment. Thank you for all you do, both in the educational and entertainment sphere. I'm here for all of it. Wishing you the best. Thank you so much. And yeah, I always talk about checking vision. You go beyond the eye chart.
Mm-hmm.
A lot of people will call me up, be like, patient couldn't see the big E on the chart.
Yeah.
Well, that's great. Like, what can
it's
they
not
see?
Great.
Right?
You should be able to see that.
There's more. Well, yeah, you should be able to see that. But even if you can't see that, can you see hand moving in front of your face? Can you count fingers? Can you even see any light? Right? There's other levels of vision perception, and I can just sense Kristen's just glazing over.
I sure am.
Just not.
But apparently,
like, whatever.
other people find this
great.
Interesting because people are listening to Knock Knock Eye. So I'm happy to accept that I'm in the minority.
Yes,
that's fine.
Thank you, Haley, for that. And nice job.
I'm glad you find
nice
him
job.
Interesting. Somebody needs to.
Send us your stories, knockknockhigh@human-content.com. And thank you all for listening. Tell us what you thought of the episode. I love having writers on.
I know.
Like, they're just very interesting. Just the ability to write a book, I'm always so impressed by.
I know. It feels like such a behemoth project to tackle. I don't even know where you even start.
I think that's the key. You just start.
You just write.
That's
what he said.
You just write. There's lots of ways to hit us up. Email us, knockknockhigh@human-content.com. We also have all the social media platforms out there. Hang out with us and the Human Content Podcast family on Instagram and TikTok at Human Content Pods. Thanks to all the great listeners leaving feedback.
And even the mediocre listeners. Thanks to you, too.
The mediocre listeners, as long as you're leaving feedback, we love you. No. As long as you're leaving positive feedback.
Oh, yeah. If you have negative feedback, you can. If it's
listen.
Constructive, we'll take it. But if you're just going to be a troll, then you can move along.
That's right. If you subscribe and comment on your favorite podcasting app or on YouTube, and give you a shout out, like @AnnLynn8708 on YouTube said, I hope I am adding to a revolution, Dr. Glock. I give your episodes to my doctors, my patients, and the general public. Thank you for standing up for the humans. Thank you. I love that. Yes, definitely give my episodes to everybody unwillingly.
Mm-hmm. That's the best way to do it.
Don't take no for an answer.
Shove it down their throat.
Full video episodes of this podcast drop every week on YouTube at The Glaucomflecken. We have lots of cool perks over on Patreon. You should check that out. Bonus episodes where we react to medical shows and movies. You can hang out with us and our wonderful little community. Our little
Enclave.
Our little enclave, our village, if you will, where you can find early ad-free episode access, interactive Q&A live stream events, much more. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, new member shout out to Heidi D.
Hello, Heidi.
Hi, Heidi. And shout out, as usual, to all the Jonathans. A virtual head nod to you all. Patrick, Lucia C, Sharon S, Omar, Edward K, Stephen G, Jonathan F, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, K L, Keith G, JJ H, Derek and Mary H, Susanna F, Mohammed K, Aviga, Parker, Ryan, Medical Meg, Bubbly Salt, and Pink Macho. Patreon roulette time. Random shout out to someone on the emergency medicine tier. Linda B. Linda B. Thank you for being a patron.
Linda B.
Linda, you can be the comptroller in our little community. How about that? We have an open position. What is a comptroller?
I was going to ask you. What do they do?
I've just heard
Just
that
sounds
word.
good.
Thank you all for listening. We're your hosts, Will and Kristen Flannery, also known as the Glaucomfleckens. Special thanks to our guest today, Dr. Anthony Chin-Quee. Our executive producers are Will Flannery, Kristen Flannery, Aaron Corney, Rob Goldman, and Shanti Brook. Editor and engineer is Jason Portizo. Our music is by Omar Vince V. To learn about our Knock Knock Highs program, disclaimer, ethics, policy, submission, verification, licensing terms, and HIPAA release terms, go to Glaucomflecken.com or reach out to us, knockknockhigh@human-content.com with any questions, concerns, or fun medical puns or jokes or limericks. Anything else?
Well, you just really put me on the spot.
Knock Knock High is a human content production.
Knock, knock. Goodbye.
Hey, Kristen.
Yeah.
Healthcare workers are struggling these days.
I know there's a lot of burnout.
A lot of administrative burden that's driving that burnout.
Yeah, it's certainly a major contributor.
Clinicians spend up to 2 hours on administrative tasks for each hour of care provided to the patient.
Yeah, that should not be the ratio.
That's not sustainable.
No.
Fortunately, we have the Nuanced Dragon Ambient Experience, or DAX for short.
Oh, is that why you've got your little friend there?
Oh, you noticed?
Oh, I did.
Yes, this is the DAX co-pilot.
He's very cute.
Isn't he? He's got wings. He's there to fly us to a world of less burnout
All right.
and more efficiency by giving us this AI-powered ambient technology that sits there in the room with you while you're with the patient, and it helps you document the encounter so you can spend more time developing that patient-clinician relationship.
That's right. You don't have to be looking at your computer. It's capturing it for you.
It's great. To learn more about how DAX Copilot can help reduce burnout and restore the joy of practicing medicine, stick around after the episode or visit nuance.com/discoverdax. That's nuance.com/discoverdax. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Help you subscribe, leave a comment below. Let us know what you think.